Well, children as young as 12 could soon get the Pfizer COVID-19 vaccine. The FDA is expected to give emergency use authorization in the next few days. Now, some doctors encourage parents to sign up once it's available. As KXAN investigator Arzo Dost explains, they say the timing is crucial as cases among Central Texas children continue to grow while other age groups slow down.
As more adults get the COVID-19 vaccines, the virus does continue to spread among those not protected, kids.
Just because more adults are vaccinated doesn't mean enough adults are getting vaccinated yet.
Pediatrician Dr. Seth Kaplan is closely watching the numbers. He's the president of the Texas Pediatric Society. He says we are nowhere near reaching herd immunity.
Our young adults in their 20s and 30s have not gotten vaccinated at a rate equal to that of our older adults over 65, which means that as long as there's a significant part of the population that's not immunized yet, there's still a reservoir of disease to be passed on to kids.
The American Academy of Pediatrics numbers from late April show that children made up 22% of all new COVID cases in the country. Dr. Kaplan says even though the percentage of cases is going up, the overall number of new cases in kids is trending downward as more adults get vaccinated. So how did the numbers look in Central Texas? Well, just in March and April, confirmed cases in Travis County among children increased at a faster rate than any other age group. Data KXAN compiled from Austin Public Health show in those 2 months, the total number of cases went up by more than 11% among those 0 to 19 years old. Others we checked with, including Williamson and Hayes counties and the state health department, don't have a detailed percentage breakdown of ages readily available.
The more you can do outdoors, the better, since we know that COVID doesn't spread as easily outdoors.
Dr. Kaplan is hopeful there will be enough data to safely vaccinate even kids younger than 12 by early fall. Until then, he's urging parents not to let their guard down.
For indoor activities, choosing to go to places that still have masking and social distancing as part of their culture, I think is really important.
Arzo Dost, KXAN investigates.
And Dr. Kaplan says if the number of kids with the virus continues to increase, then we could see a spike in the number of MIS-C or multi-system inflammatory syndrome in children. The rare illness strikes after a COVID-19 infection and can impact different parts of the body. Now, as of a few days ago, the state health department reports 151 confirmed cases across Texas. Dr. Kaplan also tells Arzo that wearing masks and social distancing is really key, especially with more children getting back into sports and other activities. He says the number of kids he's treating for the stomach flu and common respiratory illnesses has gone up dramatically. Well, across the nation, states are scaling back orders for the COVID-19 vaccine as demand declines. North Carolina and the state of Washington have cut orders by as much as 40%. Now, here in Texas, the Department of State Health Services will no longer allocate shots to providers on a weekly basis. Instead, providers can now order vaccines as needed, and DSHS will fulfill those orders as supply exceeds demand. Not everyone, though, is dialing back. Maryland, Colorado, as well as New York are still ordering their full amount of vaccines. The Biden administration announced this week that surplus vaccines will be used to meet demand in other states.